Hello, this is Shamaka and this is my analysis about the expectation that being exposed to colder temperatures in a younger age could cause you to get arthritis later in life. Let's start out talking about basics about arthritis. And here is an image about the warning signs of arthritis in the background. What is arthritis exactly? It is simply the inflammation of the joint, and a disorder that affects the knees, elbows, wrists, ankles, and neck. And a few organs that it also affects include the eyes, heart, and skin. And there are different types of arthritis, which we will go briefly later in this presentation. Ways to reduce arthritis include medications and surgery, when the very easy part that people can do is simply be physically active or exercise. And other types of therapies include hot, cold, and relaxation therapies, and having other equipment and assistive devices inside of them to help reduce the effects of arthritis. And these are the different things that differentiates arthritis from a normal healthy joint. The one on the left is a healthy normal joint with cartilage and tendons surrounding the bones and joints. And the one in the right involves the loss of cartilage and bone loss with a lot of inflammation in around the joint, around the tendons, cartilage, and bone. And the one here is an example of rheumatoid arthritis. And yes, again, these are the different types of arthritis. And ankylosing spondylitis is a chronic immune-mediated inflammatory arthritis, and this occurs in the man's third decade of life. That is around his 20s. Sacroiliacis joints, which an example of this is in the left, and this is where the backbone meets the pelvis, and these four corners are the places that are affected, and even genes play a role in this. Juvenile arthritis is simply arthritis on people who are younger than 16 years of age. And common type of arthritis is juvenile idiopathic arthritis, which has an unknown cause. And this one, osteoarthritis, is with a degenerative joint disease that affects the cartilage and bony lumps to be softened and worn away, and being able to not do their job properly. And rheumatoid arthritis is a chronic autoimmune disease that affects the lining of the synovial joints. And it's where the immune system attacks the parts of the connection between two bones and cartilage in muscles where the leg where wrist can move freely back and forth. And this actually hinders that motion since the immune system thinks that attacks it thinking that it is not part of the body. And if this isn't dealt with, it could lead to premature death and financial burden, and slowly leads to being disabled. And let's go on to the next slide. Since the last bullet is where the bone and cartilage get destroyed as a result of the immune system mistaking parts of the body for something totally different. The one on the left, far left, is a healthy joint that isn't inflamed. The one in the middle is an example of osteoarthritis, and the one in the far right is rheumatoid arthritis, where the bony lumps, it's just things where things is inflamed with those red indications. The signs and symptoms of arthritis include pain, aching, and stiffness, and they include even mobility limitations. And it is the leading cause of disability as indicated in the previous slide, and is not part of the normal process of aging. 1 in 3 adults are physically inactive, which is one of its risk factors, possibly even for rheumatoid arthritis. And these are the factors that people can actually do to help control rheumatoid arthritis from occurring. And these are the ones that people do not have a say at. But this is just a key. This is pretty much a lock. And the environment or behavioral factors act as the keys to controlling it, or turning it off or on. And this is a chart of the ways to manage arthritis from the CDC for Americans. And one of the key things that I found interesting is that physical activity, as I had mentioned previously in the previous slides, can be a simple solution to controlling arthritis. And that is pretty much what I find interesting. And here's the diagram that shows people being physically active. And let's move on to the part, or should I say the type of arthritis that I think answers the question of being exposed to colder temperature cause you to be vulnerable for rheumatoid arthritis later in life, or specifically arthritis in general. And here is the blueprint of the risk factors that people can get rheumatoid arthritis, and these are behavioral, which include the physical inactivity, obesity, smoking, and physical workloads that people cannot handle, like lifting very high levels of load day in and day out repetitively. And the environmental factor involve secondhand smoking in an outdoor environment, being outdoor environments like not being properly dressed, but that isn't as much of a factor, but it is still a factor due to people being more dressed for the outdoor environment than they are for the indoor climate controlled refrigeration environment for specific types of food and equipment, which lead to one of the factors that could lead people to being vulnerable for developing rheumatoid arthritis. And the one here on the far right are the signs and symptoms of arthritis, rheumatoid arthritis. And the one here in the center, in the middle, lower, is that this is the reference point where people, if they're exposed to this kind of room temperature, they could be potentially vulnerable to rheumatoid arthritis. But remember, this is just cold for different types of people. But for some, it's comfortable, while others, not so much. To sum up, people have different types of temperature sensitivities to what makes something cold or warm. And the genetics can act as a switch, locking mechanism, where the environmental and behavioral factors act as the key. And here, a few examples include exposures to climate-controlled temperatures for their jobs, constant repetitive habits like work by hammering a working equipment, putting it together over and over again with no breaks. And there are no cure for rheumatoid arthritis, and pharmacological therapies and gene editing are one of the options to treating that issue. And these are the pharmacological therapies for rheumatoid arthritis that are available. These include the benefits and side effects of using them with their respective dosages. And be careful and get help choosing the right type of medication or drugs with advice from your doctor. And now let's move on to the conclusion. Again, arthritis is just a swelling in the joints, and there are different types of arthritis. And genetic factors can be turned on or off for rheumatoid arthritis with environmental and behavioral factors. And all it takes is using the right treatment, but you need to be cautious because they can also have their own side effects. And in order to prevent yourself from developing rheumatoid arthritis when working in a refrigerated environment where equipment or food are kept cool, wear protective equipment and take breaks from repetitive hand movements. And one of the best ways to control rheumatoid arthritis or other types of arthritis is just be physically active. And there are other confounding variables that could be put on top that would hinder or accelerate the effects of rheumatoid arthritis to come quicker and earlier. And the question here, it just depends on the environment and situation that the person is in. And different types of cold can be depending on from person to person. And that is my final verdict about whether arthritis can be induced from being exposed to cold temperatures, especially in 60 degrees Fahrenheit room temperature. And this is my references that I have used to make this presentation. Thank you for watching. If you like this presentation video, please hit that like button, subscribe to the channel, and ring the bell to get notifications about my latest posts. And have a wonderful day.